Hawaii's Homeless, Not Our Problem by Ko'ipolemanu Diaz. This presentation is for PUBA 306, Principles of Public Administration. The PowerPoint presentation is a class assignment that demonstrates integrity and honesty with completion. I have given credit to the source in which I have found to use in this presentation because I do understand that copying the work of professional writers or other students and turning them in as my own work is identified as plagiarism, and I understand that it is not allowed. Plagiarism and cheating are serious offenses and at the discretion of the instructor may be punished by failure on this project and failure in this course, even possible expulsion from this university. The objectives that I would like to focus on as important topics for this presentation are the following. The overview of the homeless population in Hawaii, the decision-making of homelessness in Hawaii, overcrowded sidewalks as a hazard to the public, the current problems in our state government, public services offered to the homeless population, coordinating homeless prevention and response programs, developing a system analysis to calculate data and maintain services, and finding integrated solutions as a public administrator in the current homeless situation. The overview of homelessness in Hawaii. In 2005, 3,498 homeless residents lived in the Honolulu district. Now Hawaii is the highest per capita of homeless residents in the country. In many cases here, individuals ended up on the streets due to psychiatric illness, trauma, substance abuse, and/or infections for other health-related conditions. A state of emergency was declared by Governor Ige on October 16, 2015 through October 19, 2016. In response to this declaration, the state and local county governments provided prevention programs that include short-term funding and rapid rehousing locations. Topic that I like to focus on is decision-making of homelessness in Hawaii. The approach that I found during my research is the rational approach economic model based on efforts of moving forward in any situation. The rational approach is found to be relevant to the collaboration of city, state, and federal governments, community groups, nonprofits, faith-based organizations, businesses, and concerned citizens, which are all teamed up to work together in finding a relief plan of action for the homeless and those that are facing homelessness. These are some concepts that must be taken into consideration, which are policies and programs, health factors, and the health outcome or the goal of the community and the government's decision. Many social factors must also be taken into consideration with providing the utmost care for the homeless community. Some of the decisions that were discussed were the development and preserving affordable homes, increasing access to permanent supportive housing, encouraging job and workforce development, maximizing federal funds, and recognizing veterans. Overcrowded sidewalks are a hazard to the public. This image from a Kaka'ako homeless camp near the Children's Discovery Center was taken in 2015. They have done a lot of cleanup since then that have cost taxpayers well over millions of dollars. Since Mayor Caldwell implemented bills and laws to prevent homeless from sleeping on sidewalks, parks, and bus stops, they are now moving into canals and nearby streams. A recent news report, a homeless camp of about 20 people, including children, living in a canal under Farrington Highway in Waipahu. They were found to have lots of trash piled up, such as shopping carts, bikes, beds, tents, and clothes. The public is frustrated with the unsightly areas that they are occupying. They have sent in numerous complaints, and since the area near the canal is an illegal campsite, The city conducts random sweeps, and they find feces, drug syringes, and urine buckets, which are being washed into our oceans when we have heavy rains that flood these canals. The government faces many problems in dealing with the homeless, from tireless residents, or what we like to say community control, to the frustrated tourists and even the state officials. The state of Hawaii has been dealing with this problem for many years now. The lack of administrative effectiveness within the federal government in their investigation, especially now that we are all aware that other states have been flying their homeless to Hawaii and only purchasing a one-way ticket. What they're doing is selling them an idea of living in paradise and enjoying the beauty. According to a recent article, the government is facing problems with sending them back home. They have created pilot programs requesting for funds so that they can purchase their tickets to get them back to where they came from. Most of them are not taking the opportunity. This has been going on for several years now. The problems that state and city officials are facing is due to the cleanups. It is unsafe, very unsanitary for them to continue these cleanups with the depletion of the taxpayers' dollars. The city is trying to create a plan where they can designate areas across the island, even across the state, for what they like to call safe zones. This is where the homeless camps can legally live, but it can take several months for clearance and approvals for each of these programs. Public service programs that I have listed here, such as the City and County for Affordable Housing, Hawaii Interagency Council, Family Promise of Hawaii, Aloha United Way, Hawaii HOME Project, Helping Hands, and Hope Services of Hawaii Outreach are only just a handful offered to the homeless community. Each one has specific programs available for them. They are funded by state, city, and federal grants. They also look for help from the community. One program in particular that I found interesting is the Hawaii HOME Project, which stands for Homeless Outreach and Medical Education. Their mission is to provide quality healthcare services such as medical, social, and vision care to the homeless population. The volunteers that go out and help provide these services are from the University of Hawaii pre-medical students, John A. Burns School of Medicine medical students, University of Hawaii and Tripler Army Medical Center resident physicians, and the University of Hawaii faculty and community attending physicians. This is a great organization because not only do they provide free services, but they also offer mobile health care since many of these homeless individuals don't have transportation to a nearby medical facility. With coordinating homeless prevention and response programs, Governor Ige appointed Scott Morishige as coordinator on the state homeless problem. The state framework to address homelessness in relations to public administration would be to combine efforts with the community in gathering those that can help with building affordable housing, provide health and human services, and especially creating a safety plan for the public. Many state programs have collaborated utilizing interoperability of gathered information and data collection to create pilot programs in order to present them to the state and city officials. Through the coordination and collaboration with the city, state, federal governments, community groups, nonprofits, and concerned residents, They are working together to provide a relief to the homeless crisis in Hawaii. The data that was gathered and collected here was brought to you by Homeless Point in Time organization. According to their research, during the 2016 fiscal year, homeless programs in the state served a total of 14,015 clients, with 973 in rapid rehousing services, 8,702 in outreach services, and 7,313 in shelter services. 20% of clients use 2 or more types of programs. And out of 7,313 shelter program clients, 4,540 were enrolled in an emergency shelter program, 3,910 in traditional shelter programs, and 15.5% in both types of shelter programs. Now, I would like to end with focusing on an integrated solution by using public administrators in Hawaii. The public administrator that I'm more focused on consists of the government, city and state officials, especially our governor. So Governor Ige has been involved in the planning and the gathering of agencies working together to get this homeless problem under control. One of the messages that he had presented on his website that I found during my research is leveraging additional state funding to attract more private investments to construct more affordable housing. So his idea would be to focus on developing affordable housing here in Hawaii that would provide homes, permanent homes for these homeless individuals. He'd also like to identify and develop, vacate, and underutilized state lands for affordable housing near Oahu rail stations, public transportation, and employment centers, and whatever possible include daycare, senior centers, and community facilities as part of a new affordable housing site. So basically building a community for the affordability of the people here in Hawaii. He wants to work with the counties to expedite planning and construction approvals so that affordable rental housing can be built in a shorter time and at a lower cost. He wants to build more affordable housing units in the Kaka'ako area, which is fully under the state control. He wants to provide a unique opportunity to generate new affordable housing, upgrade and increase the public housing authority currently right now that our state has. Our state is the one that controls the public housing needs, but he wants to operate a qualified nonprofit and even a private company to tend to the issues that the residents are experiencing. He wants to have them be addressed immediately. He wants the facilities to be properly maintained and units added that are targeted for mainly low to poor income seniors and also to those that have special needs. He wants to collaborate and support the county's efforts to address this homeless problem that we're facing. He supports the Housing First initiative, which provides traditional and permanent supportive emergency housing. It also offers a referral service for mental illness, addiction, job training, and other social services. Support homeless shelters that provide immediate physical and mental health relief for these homeless individuals and their families. Shelters provide the first step toward permanent rental housing and job market reentry. He wants to help with building those programs for them. provide our homeless military veteran population with affordable housing and support their services as well, and improving a coordination plan with with improving coordination and collaborating with the Veterans Administration Department here locally. He wants to support the Judiciary Hawaii Veterans Treatment Court, which began last year, that helps veterans arrested for nonviolent crimes and who may be suffering from PTSD, mental health problems, or substance abuse with resources and treatments needed to get healthy, needed to get back employed and acclimated back into society. So this is some of the solutions that our governor of the state of Hawaii is trying to work towards. The public administrators that are teamed up with him, the state and city officials, as well as his coordinator, Mr. Morishige, is collaborating and connecting with each other to provide the utmost successful solution for the homeless crisis here in Hawaii. Now, as we end here in the reference page, I'd like to thank you for taking the time to review my presentation on homelessness in Hawaii and how public administrative is an effective resource to have for the public and even for the homeless community. We public administrators consist of government and city officials, also nonprofit organizations. In collaborating, it is easier for the community to get involved, to find solutions, and to find ideas and new ways that we can find a solution to this problem that not only does it affect the government, but it also affects the community. So thank you again. Aloha.